to measure the distance from your left eye to your left ear. Right at about 3 inches there. Just brushing. Just visualize along the ear as well. Just looking for any abnormal debris, dislodgement of skin cells. So I just want to check both sides at the same time. Still slightly more responsive on the left. And here, can you feel that? If I do this other more flat side, anything here? Anything here? That's good. Alright, Miss Lucy, we are going to go ahead and get started with your examination this evening. Now, we have you in for kind of an overall inspection of your head and just shoulder, upper body area. So I do want to have a look at a couple different things and see if there's anything I think is rather concerning. So aside from the headache and kind of symptoms you were describing to me earlier, I do feel just a bit of warmth here. Can you tell me more about how you've been feeling recently?
Yeah, I just feel like I have a lot of tension on my neck.
Okay.
And I think that my headaches have gotten worse as we're getting to the end of the week.
Okay, and is the tension like on the sides of your neck?
Yeah, like specifically this side.
This side. Okay, alright.
My headache feels like it's like coming from like my eye area.
Oh, okay, so you've definitely got probably some inflammation happening of the cranium as well. Okay. So I'm going to do some palpation, definitely. I want to feel around and see if I feel any areas that feel particularly swollen or edematous. Okay. So I want you to just relax for me. There will be some times where I'm shining a light, so I don't want it to be too harsh on your eyes. So you're welcome to just relax. And let me know if any of this causes you any particular pain or discomfort, if there's any areas that are tender. So I'm going to start here at kind of the forehead area. And I'm just going to feel around with my hands. Now I will say that I'm already feeling some areas that feel slightly warmer, which is just a little bit concerning, especially around the temple. It does feel a tad bit warm there. Let's see. The left side. Yeah, so I actually would say that it's maybe just a little bit warmer on the left side, which just makes sense if you feel like the tension of your neck is worsened on this side. So I'm going to feel underneath the chin, palpating along your chain of nodes. I want to see if maybe this could be caused by any underlying infection. Have you been sick at all recently?
I was sick around the holidays.
Around the holidays, okay. So unfortunately, this is the time of year where a lot of different things are going around, so that is fairly common. Could be some residual inflammation here. Just gonna palpate here. Just feeling directly below the mastoid process, feeling for any signs of inflammation there, as well as at the clavicle. So you are holding a fair amount of tension here. Feel along your clavicular nodes. So we have chains of nodes that run kind of down along the collarbone. Just feeling above and below that. Okay. Not as much warmth there, so that's a good sign. Just feeling the upper extremity for any signs of abnormal swelling. Okay. perform a couple of movements here, Lucy. I want you to tell me if any of it feels more painful. So if I move your head this way, does that cause you any more discomfort? Yeah, on that side? Okay. And if we go the opposite direction, any discomfort there? Not as much. And if I rotate in a circular motion, any more or less discomfort there? About the same? Okay. So we definitely need to have a look at that neck strain. Now, you also mentioned that you've been having trouble sleeping. So I do think that we maybe need to consider finding some interventions that can help you get a more restful night's sleep, especially since you've been having that kind of tenderness and pain or swelling behind the eyes, just kind of around the orbital socket and orbital region here. So I'm going to do just a brief inspection here, and I just want to see if I'm noting any swelling just above the eye. Now I will do a more in-depth lighted inspection, but I do want to get you fitted for one of our Manta Sleep Masks. I do think it will be quite beneficial for you on your journey to better sleep. So I'm just visualizing for symmetry the nose, which is present. Not seeing any notable swelling along the brow bone or below the orbital socket. You do have quite long lashes, so I think the C-shaped eye cups will be beneficial for you, and then it won't put too much pressure on both the lashes and the eye itself. So I'm going to take a couple measurements here. I want to ensure that we are getting the most adequate fit. So just going to measure directly along the brow bone and coming around. Looks like we're at about 21 3/4 inches there. And also just going to measure the distance from your left eye to your left ear. Right at about 3 inches there. And if we do a bilateral measurement here, actually about 3 1/4 there, so that is good. I will go ahead and make note of that so we can ensure proper spacing with the eye cups. And I'm also going to measure just in between at the bridge of the nose. So from tear duct to tear duct, you are right at about 2 inches symmetrically. So I will accommodate for proper spacing in between the eyes and along the bridge of the nose as well. Now, I think today I'm going to recommend the Manta Sleep Pro Mask. I do have this new colorway. It's a beautiful kind of light purple hue. Lovely color. Now, this is a very breathable fabric in that it has mesh lining, so it's not going to, increase heat around the face, nothing that will make you uncomfortable. And as with all of Manta Sleep's masks, they are fully adjustable, fully customizable. So I'm going to measure to your exact specifications. So we will do 2 inches at the bridge of the nose to allow for proper spacing and comfortability here. So I'm just going to adjust the Velcro appropriately. Now, as I stated, you do have very long lashes, so the C-shaped eye cups do provide for quite a bit of spacing, as you can see. So just to show you, you should be able to fully open your eye and not fail the cup at all.
Yeah, that feels comfortable.
So even if you're sleeping on your side, they taper off nicely around the temporal region, so even where I'm feeling some inflammation, it shouldn't cause you any excess tension. I'm going to go ahead and try this on you. And I just want to ensure that we're obtaining the most comfortable fit for you, Lucy. Should we need to adjust, we can. I do find that this fabric feels quite nice along the skin. It's not too harsh or abrasive, especially around the delicate skin around our eyes. How are those eye cups feeling for you, Lucy?
It feels really, really nice. I love how dark it is.
Good, okay. So all of Manta Sleep's masks do have a blackout feature, so I'm actually going to test that out for you. So I am going to shine my light above and below the eye line, and I'd like you to tell me if you're able to see any light shining through the mask. If so, we can adjust as needed, but you should not be able to see any light here.
I don't see it.
Coming along the bottom as well, you shouldn't be able to see any light peeking through the mask. And as I shine directly into the mask itself, you should not be able to see any light there. Good. Okay. Alright, that's very good. Just going to use my tweezers here to see if we need to tighten up any areas, but I think we got pretty good fit. I'm not feeling any excess fabric, no bunching. And it is taut, so it won't fall off your head while you're sleeping. There is also a silicone strip at the back that grips onto your hair and keeps it from falling off. So I do think this is quite a good fit for you, Lucy. I'm going to remove the mask. Now bear in mind that the reintroduction of the light can be slightly abrasive, so give yourself a second to adjust. Now, I'm going to be sending you home today with our Pro Mask, and if there's anything else you would like to purchase from Manta Sleep, I would like you to go to the link in both the description box and in the pinned comment of this video. And as always, of course, we would like to thank Manta Sleep for sponsoring this portion of today's exam. As we move further into the examination of your head and neck, I'm going to hold your hair out of the way for just a second here. And I'm just going to do some visualization of the area where you said you were experiencing some of that kind of tenderness and distension. Slightly firmer palpation here, feeling directly along the muscles. Feeling for any nodules, any excess tightness. As I press down here, is that painful at all? Yeah, tender. Okay. Alright. Do you feel just a little bit of swelling here, I would say? I just want to see comparatively here on the right side. Certainly not as edematous. Alright, Lucy, so I think the first thing I'm going to do is I'm going to go in with my tool to reduce inflammation to start with. So start here just on the left side. I'm going to roll some of that excess fluid down across the mandibular joint and carry that down the neck, out and away at the shoulder. So this is just going to encourage dissipation of any of that excess fluid, relieve any increased swelling, and the coolness also provides a nice relieving sensation. Gentle rolling massage here at the affected area. And carefully down the back of the shoulder. Good. Also just going to start here directly next to the thyroid and come back towards the back of the neck. And down across the scapula. Very good. One last time, encouraging that lymphatic drainage. We're going to go down and out. So I think I'm going to come into the scalp and do a bit of manipulation here. So you're going to feel a very gentle tugging. Very mild tugging at the follicle. And then a release of pressure. And again, a very mild tugging at the follicle. Followed by a release of pressure. Now you rest your head just very kind of heavily here for me, Lucy, in a way that feels comfortable along the throat and thyroid. And I'm going to do some very gentle therapies here along the hairline as well. This is just delicate pulling, nothing painful, nothing excessive. Just introducing the sensation. This also allows for spacing between the cranium and the skin. So it just allows for some of that fluid to move. Same as with the ear. I'm just going to do a very gentle outward pulling of the ear, down and out, up and back. You might feel some popping or some fluid release. All of that is normal. Followed by some gentle movements down the neck. Just kind of feel around here for any abnormal nodules. Just using the tips of my fingers to palpate gently. Seeing if I can feel anything abnormal here. Just also want to feel along the neckline. See if there's anything concerning there. Just visualize some of these areas along the neck as well. Not quite as much inflammation here. the neck. Maybe some mild inflammation there. I'm just going to compare that to the other side. I want to see if there's any noticeable differences here. So just gonna use this little tool here. It's going to allow me to adjust visualization. Just brushing. Just visualize a little bit here as well. Just looking for any abnormal debris, dislodgement of skin cells. As we go down, checking for bilateral edema. Looking for any differences on the left side. And down along the neckline as well. So far, nothing particularly notable, which is really good, but I do just feel some signs of temperature variation. So I think I'm going to go in and do some neurological testing, Lucy, because you're experiencing the tension on your left side and not quite as much on your right side. I just want to ensure that this isn't something that could be caused by some sensory abnormality. So I have two fairly identical tools here, different color, but they are same in stimulation. So I just want to give you an example. These should feel about the same. So I'm going to touch just kind of different areas of your face, neck, chest, and arms. And I really just want you to tell me if anything feels different. So now, just as a baseline here, you should be able to feel this on both sides, correct?
Yes.
Okay. So I'm just going to touch you equally on both sides to start with. And I want you to just tell me if it feels different from one side to the other. So as I come down, does that feel the same?
I feel like I feel it more on the left.
More on the left, okay. And here at the brow bone, does that feel the same? Is it again more on the left? And if we come down below the eye, does that feel the same?
Yes.
Okay. Here down across the nose, down the nasal labial fold, does that feel the same? And I'm going to come upwards now. So if I come up the chest wall towards the clavicle, does that feel the same?
A little. Not really.
Not really. Okay. I'm just going to make sure. So I'm going to do that one more time. This time I'll come inwards and up towards the clavicular line. Does that feel the same?
No. I feel it more on my left.
More on your left. And here, does that feel the same? And then directly along the affected area, does that feel different?
Yeah.
Okay. Alright. So I'm going to touch you on varied sides now. So you'll feel here, 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 here. I want you to tell me when you feel it, okay? Do you feel that?
No.
Do you feel that?
Yeah.
How about here? You can feel that, okay?
Yeah.
And you feel that? And here, can you feel that?
Yes.
Okay. So now if you relax your head, I'm going to do, can you feel that? Yeah, good. And here you should be able to feel that. So even physically, I do see more of a reaction on the left side, so I can feel that, but this side just seems to be a little more responsive. So I just want to check both sides at the same time. Still slightly more responsive on the left. And here we go. Bit of a better response bilaterally there, so that's a good sign. Okay. And here, can you feel that? Here, can you feel that? Left side, right, left side, right side. Okay. Noticeable difference in responsiveness there. Alright, I think I need to test that with something slightly more distinct. I have, let's see. I'm going to start with this one here. Do you feel this at all, Lucy? Is it less as I come down?
Mm-hmm. I don't feel anything.
Nothing here. And then if I continue down the arm, a little bit. But as I come back up, it diminishes just slightly. And then on this side, you feel all of this. And all along the ear, you feel that. And down along the tenderness, you feel this as well. Slightly increased reactivity around the clavicular region on the left side. I have another tool that is very, very distinct. It has a very small point. It's not going to cause you any pain, obviously, but just slightly blunted. Can you feel that there?
Mm-hmm.
Just ear externally, can you feel that? And here, can you feel that? If I do this other more flat side, anything here? Anything here? A little bit. Okay, that's good. And down along the chest wall, nothing here. Down the arm, anything here? A little bit. Good. Okay. There's not a total loss of sensation, which is good. Then I'll start with the blunted side on the left. You should be able to feel that this is just slightly more pointy.
Mm-hmm.
And then as I switch to the softer, kind of flat-handed side, can you feel all of this along the ear? Okay. I come down along the neckline. Are there any areas here where you can't feel anything? And of course, testing bilateral sensation down the arm, you should be able to feel that. Just gonna do some more palpation here. I'm gonna see if I'm noticing any decrease in responsiveness from either side, which just slightly on the lower side. So I do see some diminishment there. All right. So I'm just gonna have a look. Some focal points along the scalp as well. So your hair is very thick and it is quite heavy, which I do find sometimes can lead to headaches, even neck pain or neck strain in some of my patients. Just feeling around here. Do you notice at all if the pain and discomfort is worse on days where you wear your hair up? Yeah, okay. That kind of makes sense. The more taut you have your hairstyle, the more pressure it puts on the cranium and the neurons that handle your brain's perception of pain and discomfort. So,
I've been wearing it up a lot.
have you? Okay. So that could make sense. It could be why, just testing for any rigidity here. It could be why you're experiencing some more discomfort. It really puts strain on the follicle, and again, it just kind of increases the reactivity in your pain response. Do you feel just a little bit of rigidity there? It's not terrible though. Slightly better here at the scapular indentation. Good. Alright, Miss Lucy, I have tested a few different things. Now, there is some slight neurological deficit that I'm noticing from one side to the other. It does appear as if you are lacking in sensation on your right side. However, you are slightly hypersensitive on your left side. So while you are kind of misaligned and having some tenderness on the right side, I do think it would be good to have you in for a dedicated sensory assessment because I did notice quite a bit of discrepancy. So you have one area here that's almost completely numb, and then some loss of sensation here along the side of your of your right side. And then your left side was significantly more hypersensitive. Okay? So for now, I'm going to go ahead and send you home with the sleep mask. I want you to focus on getting a better night's rest. I will work on getting you a referral over to our neurologist to get you in for that dedicated sensory assessment. And in the meantime, should any of your symptoms worsen, I would like you to come back in. Okay? All right. So please stay tuned for a follow-up there.
Thank you so much.
All right. Thank you so much, Lucy. I hope you get home safely.